Hello, my name is William Christopher Walden Jr., and I'd like to thank y'all for joining me today to hear my presentation on the death rates within the United States. So, today we'll be looking at the death rates in the United States as well as some of the leading causes for those deaths. So, looking at the average life expectancy in the United States is around 80 years, but however, if we break down the demographic, we can see that women have a higher life expectancy than men. This is only about 2 years, though. And thanks to advances in medicine and technology and in the way we live our lives day to day, life expectancy has increased about 30 years in the past 100 years. So, if we look at the given examples for some of the leading causes of death, we can see that some of the leading causes are cardiovascular disease, suicide, chronic lower respiratory diseases, and cancer, which these are 4 of the 10 leading causes of deaths in the United States. So if we look here at example 1, you can see that there are different types of heart diseases, including heart attack and heart failures. Example 2 will show you the several different types of chronic respiratory or chronic lower respiratory diseases. These include diseases such as pneumonia and airway diseases, which an airway disease are diseases that affect the bronchioles within the lungs. These diseases are such like chronic bronchitis and asthma. uh, Looking at our third example, cancer is the second leading cause of death. There are many different types of cancer, ranging from brain cancer to lung cancer, liver cancer, and pancreatic cancer. And in the fourth example we can show the suicide rates, which if we look at that, we can see that whites and non-Hispanic whites have the leading in the suicide rates. So my references include University of Pennsylvania, the CDC, and Our World in Data. The University of Pennsylvania has looked at how the death rates and mortality have decreased from the new advances in technology and medicine. Since these new advances have been made, there have been decreases in the mortality rates. This is because doctors have the ability to treat more illnesses and diseases than they have before in the past. They also have more medications to care for these diseases and illnesses. So your options for treatment are broader than what they used to be, and it's not just one type of medicine that you have for different types of illnesses and diseases. The CDC looks at death rates and the life expectancy for both males and females, and Our World in Data looks at the death rates from countries around the world. It takes the leading causes and compares them around the world. This one.